I'm Lubelle D'Luna O'Grady, and I have been a simulation lab coordinator for the past 2 years. I've been a nurse for 29 years, and I am a clinical nurse specialist.
What was the description you were given of what your job would entail?
Well, I would have to be doing it all. By that I mean audiovisual, the fixing of the mannequins, mainly running the equipment, utilization of the software, and how does one connect with the audience and really invite folks into the program. So I knew I could do it.
What was the equipment that existed when you were hired?
I have to say we did have the SimMan Classic, we do have the NurseAn, we do have Sim Newbie, Sim Baby, and Mega Code Kid.
Did you have funding that was available to you when you began the program? Who did you work with, and how did you develop a plan to create the program?
So part of it was tough for me. So part was they had done a fundraising called the President's Cabinet, where the hospital had the education team meet with possible donors and potential donors, and they came in, they did a walkthrough, they explained that we had this space, we want to create a simulation lab, we need to have funding, we wanted to buy these many mannequins and simulators, and they had a vision for how they would create a program to where staff could come in, practice what they do at the bedside, and feel comfortable with their skills after having practiced on a mannequin and going back out to the bedside and really delivering the excellent care that they really have been providing to the community.
What were the key elements in creating the curriculum for the SIM program?
For me, first, in terms of a curriculum, you have to know how the organization is organized and what is their infrastructure. And so by saying that really is, were there service lines? In this particular organization, there are 5 service lines. So we have the med-surg, we have the cardio-neuro-ED, we have the maternal newborn services, we have ancillary, and we have surgical services. So knowing that there were 5 service lines, I needed to know who those key stakeholders are, because in any organization walking in and trying to create a program, you have to know who is supportive of the program, who's got an interest or an investment in it, and then to hear what they typically would want or envision for the program. And I think that's a very fundamental concept that sometimes folks go with whoever's in their department that's providing the one linear or tunneled direction. And instead, I think I was given a very great opportunity, and I think just seeking out and saying, who's our key stakeholders, who's our directors and management team, who are the VPs, and who's the senior executive team, what investment do they have, and what do they want out of the simulation lab?
You know, moving from executive and trickling down, how did you get the buy-in, and how did you move forward with making decisions about class size and material?
So once I had learned the software, and I started that in January of 2013, so a little a year and a half ago, and what I had done to be able to get that executive support was really, I think they'd had the vision in terms of buying and purchasing to support the equipment. They had hired me, certainly a salary that they had to pay. I felt they were engaged already, so I went to my director and then went out to what we call a key stakeholder meeting that we have when we're planning our whole year's program. So at each meeting, I sat in. So as we had the key stakeholders, I was there to partner with whoever might have been the VP or the executive for that particular service line, in addition to their directors, there could be a couple directors under a service line or even more, managers all across the board. So I kind of had that tiered approach, starting with the executive, going to these key stakeholder meetings, going to all the planning meetings and talking about SIM and saying we can introduce SIM and the win-win for them. I think the key thing is to always figure out what their vision might be, but if they don't have the understanding, you have to very simply provide them with an understanding how it can benefit them. And I think that's what I was able to with the education team and my director, to be able to share that and say, here's what you have, here's what we can accomplish, and is it a benefit to you? And they're like, oh really? Wow, we're in.
Now I remember in your presentation at the Mini Sun, you spoke about risk management and how you really took advantage of initiating a relationship with risk management and how that also helped in growing the program. Can you talk to a little bit about that?
Sure. So I was reporting up through the CNL. We were our reporting structure, but we also have another area called clinical excellence. So clinical excellence, they are the ones who manage the risk management department, reports up through that VP. So I had the opportunity, because as I started in simulation, we thought, okay, well, what kinds of things are plaguing the organization? I came from a previous background of having a risk management, not as a risk manager, but in a medication safety capacity in another facility. So my attention to that area of risk and what are the outcomes, and if we're driving towards outcomes, because that was the message I was getting, I was questioning what is it that we have in terms of harm events and how can we reduce those. And if we practice in simulation, I could drive to the outcome that the hospital initiative was driving toward.
What would you say your largest obstacles were and how you overcame them in creating the program?
I think the largest obstacle is it's getting staff to come in for the time investment, the education investment, because it does take 2 hours at minimum, depending on the number of sims that you might do. Well, I figured I had 3 rounds. I could do 3 sets of scenarios, 3 scenarios, and I could put 4 to each scenario. That would allow me 12, and depending how many sessions, and if a department had 48, I could do X number of sessions, and their department would be completed within a reasonable time. So I try to do a 2-week time frame to figure out what would best suit the department. And I would talk to the manager and director, and you say, you know, this month is really good, these dates are really good for us, this time frame. They kind of give me some loose parameters within which I work with, and then I'll go back to them and say, here's what it is, and does this work for you? And they go, yeah, this would be great. So then I set it up and then schedule staff, when we use HealthStream, to help staff to be able to register themselves in the program for the respective sim. We do have the dates and times and the assignment all laid out. I do put a flyer together in collaboration with our education assistant and make sure that as an organization, we are really looking at the benefit of what is it that works for our staff. From a scheduling, from a timing, what are the best times, how many sessions, and the least amount of resources being fiscally responsible.
Now, are the hours that the staff are spending in learning time hours that they are volunteering or hours that the hospital has created funding for in continued education?
Okay, the hospital is very proactive in that and very good. They have created the ability to get the staff paid to come to simulation. They don't pay for practice or for remediation, but they do pay for you to come in and do your sim. So I try to see if it's 3 scenarios, I usually allot 3 hours, sometimes 2.5. If it's a simple scenario, then I usually do 1.5 hours to 2 hours. All depends on the complexity of the scenario.
So then kind of, summing everything up, if you can, I want you to describe where you feel your program is now. Still growing? Have you accomplished the majority of your goals? If not, if you could describe what your next endeavors are and how you plan to accomplish your future goals.
Yeah. No, I'd say I'm never going to be done in simulation because there's a ton for me to still learn as being 2 years in this position. I certainly feel like I have mastery over the simulation development and the structured tools and process. I wouldn't say I have complete mastery over all the pieces of the mannequin, the internal pieces of equipment, like as a field technician would, or lateral tech support, but I certainly have, I think, a relatively good understanding. That being said, I think my first year I did 18 departments for simulation, 15 were nursing driven and 3 were ancillary. So I kind of did them in portions to see how each department worked. I had not included an entire service line at that point, which was the maternal newborn services. In year 2, I put 32 departments through simulation, 983 staff through simulation, and like I said, a multiple number of disciplines. So I certainly almost doubled that capacity because I was on a roll. And I create my schedule, which I think is often a challenge. I do that in advance. So if the fiscal year is starting in July, by June I've already got a whole year's calendar for the fiscal year from July through June. I map it out who's going to go where. I talk with the managers and directors and plan the months in advance. About a couple months before they start, I start giving them the dates, the times, the specifics, putting all this in health training, ensure everybody's able to register. And in year one was 805 staff. In year two, I certainly made the numbers larger. However, in year two, I had 87 validators. In training all of them, I found that I actually could reduce, even though my numbers went up, my numbers actually went down for multiple departments that were very large. I could use fewer people because they were better skilled and trained. So as I brought them in, I actually reduced my overall cost, and I made it more cost effective because I could maximize the number of staff in a given simulation by the number of scenarios that I had. I brought in the staff when a patient is coming in for surgery. I said, you know, the piece that we're missing is who's calling them. We're doing SAA, which is a surgical admitting area first by itself, then we're doing operating room, then we're doing PACU. We need to have the patient go all the way through, and I want to see what the patient experience is like.
Right, I remember that.
So I brought that in, and I brought in the surgical outpatient testing center where you get screened. So we actually brought them here into our sim lab. We had them interview a patient's husband who volunteered. He was a volunteer, and he's had experience in here before or elsewhere. So he came in and we had him play the role of the patient. The nurse screened him. Then we brought him in, like the pre-op department. We would say, okay, the pre-op is coming in. Pre-op would come in and he would be brought into the pre-operative area. Then we would go to the OR and do the OR piece, and then go out to PACU, and then phase 2 and go home. And or transfer to a unit or to the med surg. So we would make that, complete that simulation with that transition out. And then we would solicit and ask from the patient experience, what was his experience every day as he came in? He did 11 different sessions, and to be able to see how he felt with each team and each group. And we gave them feedback in real time during our debriefing. So it was tremendous.
How did you capture the video on that? Did you use webcams?
Yes, I did, and the webcams have been the best because the stationary cameras don't afford me that opportunity. So what I was able to do was upstairs in the sim lab, which is on the 3rd floor, we had a room that was set up for, my control room was where the patient sat and the nurse was screening because we had all the other team members in the room listening. So the patient had privacy to answer the questions, but it was on a speakerphone. Then the patient was brought in front of the other staff who were sitting, but only the SAA nurses got up and did their sim. Then we turned around and wheeled that same patient down to the operating room where I had taken SimMan and embedded him there in the OR suite. So then the OR team did their piece, and then they wheeled him back up here for PACU into one of our other rooms, and I videotaped in 3 sections. So I had to videotape outpatient testing and pre-op first, then I did the OR downstairs and came back up here and did PACU and phase 2, which is PACU phase 2, up here. So that's kind of how I integrated it. So I felt like we had done a divisional approach, which is making sure everybody in that particular division was integrated into simulation. And so each year I'm going to be layering on my program till it's world-renowned, state-of-the-art, and I have people flying from all over the world, that's my vision, and come in here and check it out and really see what difference it's making in the community and for our patients in general. So, and my vision is really to cater to the Fullerton community, and I even our maybe sister ministries in the future to be able to allow them to come, even if they have to use a sim lab once a week or something like that.
Well, thank you so much, Lubelle. I really appreciate you entertaining an interview with us, and I really think that, especially highlighting that patient experience, I think that's incredible, and the fact that it's, it's something original to St. Jude is definitely, they're really lucky to have you.
Oh, thank you. I'm glad to be here.